Getting a diagnosis for something like acute myeloid leukemia, or AML, can be, completely overwhelming. So today, we're going to walk through what that journey actually looks like, step by step. We'll use insights from Dr. Colin Phipps DeYoung to cover everything from the very first warning signs all the way to the path toward recovery.
So you're probably asking yourself, what are the first signals my body might send? And after a diagnosis, what happens then? Well, that's exactly what we're here to break down for you, with clear, direct answers.
All right, here's our game plan. We've got 5 parts. First, we'll get a handle on what acute leukemia even is. Then, we'll dive into the warning signs, the diagnosis process, and what treatment looks like. And we'll wrap it all up with a really important message of hope. So, let's start at the very beginning.
Okay, first things first, let's get really clear on what we're talking about here. What is acute leukemia? Getting these fundamentals down is the key to understanding everything that comes next.
Now, this is something that comes up a lot, and it's a really important distinction to make. People sometimes mix up blood cancer and autoimmune diseases, but they are fundamentally different things. With an autoimmune disease, your own immune system gets confused and attacks your healthy cells. Blood cancer, on the other hand, starts in the factory that makes your blood cells, the bone marrow.
Let's zero in on AML specifically. It's actually one of the most common blood cancers in adults, and it all kicks off right there in the bone marrow. So if you think of your bone marrow as a super efficient factory for your blood cells, AML is what happens when that factory's quality control just goes out the window. It starts pumping out tons of faulty, abnormal cells instead.
And that word, acute, it is so important. It has nothing to do with how severe the illness is, it's all about how fast it happens. These abnormal cells multiply so rapidly that they just crowd out all the healthy ones. And that's why someone can feel totally okay one day and then get really sick really fast. It's also why getting treatment started quickly is so vital.
So, if that blood cell factory isn't working right, how would you even know? Well, that brings us right to our next section, recognizing the warning signs. What are the alarms your body might sound?
And here's the thing. These aren't just vague feelings of being a little off. They're pretty specific signs. Take a look. A fever that just won't quit, losing weight without trying, bruising super easily, or just feeling completely wiped out. Every single one of these is a potential red flag that something's wrong back at headquarters, the bone marrow. Okay, so you go to the doctor with some of these symptoms. What happens next? That question leads us right down the path to getting a diagnosis. Well, the path to diagnosis is actually pretty clear-cut, step by step. It all starts with those symptoms we just talked about. From there, a doctor will order a super common but incredibly powerful test called a full blood count. And what's amazing is that simple blood test can often spot the leukemia cells right there in the bloodstream. But for the final definitive answer, the last step is a bone marrow biopsy to confirm everything.
And that last step, it is absolutely crucial. A precise diagnosis is the foundation for everything that follows. You see, there are lots of different types of leukemia, and getting that exact classification is what lets doctors create a battle plan that's tailored just for you.
And that brings us to the really big one, treatment. For many adults with AML, the way forward involves a treatment that's really about getting a fresh start, a stem cell transplant.
The best way to think about a stem cell transplant is like hitting the reset button on that blood cell factory. The whole idea is to completely replace the unhealthy bone marrow with a brand new, healthy system that grows from donated stem cells. And why go through all this? What's the end game? Well, this quote from Dr. Phipps DeYoung says it all. A stem cell transplant isn't just about managing the disease. It's about increasing the chance of a cure. That's the ultimate goal. So where do these new, healthy stem cells come from? Well, basically 2 places. An autologous transplant uses the patient's own cells that were collected earlier. But for AML, it's more common to do an allogeneic transplant, which uses cells from a donor. This could be a brother, a sister, or even a stranger from a registry, which is why finding that perfect donor match is such a huge deal. Now, we've got to be real here. This is an intense process. Patients stay in the hospital, usually in a special room to keep them safe from infections. And why is that? See, to make room for the new cells, the old immune system has to be completely cleared out. It takes a while for those new donor cells to settle in and build a brand new immune system from scratch. And that whole process needs very, very careful medical oversight. So, after all that, the diagnosis, the treatment, it all leads us to the most important part of this whole journey, a message of hope, and a look at what the future holds for patients today. The most important thing to remember is this: the world of blood cancer treatment is not what it was years ago.
It has changed, and it's changed for the better. Thanks to incredible medical advances and those super accurate diagnostics we talked about, there are now many effective treatments out there.
And I want to leave you with this last thought, and it comes straight from Dr. Phibs Dayang. It's a message for patients, for families, for friends, for everyone. With the right diagnosis and the right treatment, there is a path forward. The message couldn't be clearer. Don't give up hope. Thanks for joining us.